Hi, it's Lee Brandon here, injury rehab specialist. Now, wouldn't it be great if you could wake up every day and your lower back felt amazing and you could do whatever you wanted to do without any limitations or restrictions? Well, in today's video, I'm going to talk about lower back pain whilst running. Now, as we know, running is very popular around the world. There are millions of people running, but there are also millions of people running with lower back pain. So, what potentially could be causing lower back pain in runners? Well, the first thing you need to consider is, when you're running, if you're doing about a 6-minute mile pace, you're taking about 1,000 strides per mile. And also, if you consider when you're running, you're also putting a load of about 4 times your body weight through each leg with each stride. So if you're going for a 6-mile run at 6-minute mile pace, that's 6,000 steps. Now, if you take your body weight, so let's say you weigh 80 kilos, and you times that by 4, so that's 320 kilos, times 1,000 per mile, so that's 320,000 kilos per mile, or 160,000 kilos per mile per leg, times 6 if you're doing 6 miles. I can't even work that out off the top of my head, but what it is, it's a lot of load going through the body, and obviously the spine has to help to dissipate some of that load. So, if you're running 3, 4, 5 times a week and you're doing 4, 5, 6 miles or more, you're putting a tremendous amount of stress through all of the tissues in your body. So you really need to make sure that the body's in a really good position and got the really good base conditioning to be able to handle all those loads. So anyway, I'm going to talk a bit more about that in a future video, but what I want to go through is just talk about some of the individual conditions that might be causing the actual pain. So the first thing is a disc bulge. Now, if you've watched my previous videos, you'll know that around 76% of the general population that don't even have any back pain have significant damage to their lumbar discs or a lumbar disc bulge. Now, from my experience, what I tend to see is that, again, most people tend to have what's called a flat back posture. So if I just show you Rodney here, so let's say that's a normal lumbar curve. So normal is considered to be around 30 to 35 degrees. Now, if I just straighten up a little bit more, that would be considered a flat lumbar spine. Now, what happens in that position is the discs get squeezed at the front here and they get pushed in this direction. And as you'll see, these are the spinal nerve roots and also the spinal cord are there. So that's how you can create pain, by irritating the spinal nerves with a disc bulge. Now, as I said, most people have lumbar disc bulges. So again, imagine about all that load going through the spine is creating compression at the front of the disc, pushing the disc backwards, irritating the nerve. So that's one potential cause. Another one could be coming from the facet joint. So if we look at Rodney here, I don't know how easy it is for you guys to see, but the facet joint here is basically connecting the back of the vertebra. So this is L4, so that's the superior facet of L4, sorry, of L2, and here is the inferior facet of L1. So superior facet of L2, inferior facet of L1. Now, the facet joints help to limit movement in the spine, so there's not excessive movement, either predominantly side flexion, rotation, but also in extension. Now, if you're running and you're unable to maintain, again, what's called a neutral spine, so if you're excessively extended, so that would be this way. Now, whether you're like that in standing or just during running because you can't stabilize the pelvis and it creates you to go into an extension of the lumbar spine, those facet joints don't have as much space to play with. So they could be bumping into each other, and over time that could create microtrauma. It could create a cyst in the facet joint, but it could just become inflamed and painful. So that's another one. Now, if that condition continues onwards, what you might end up with is actually a fracture, and it would be a fracture in what's called the pars articularis, which isn't on the facet itself, it's a little bit above or below, depending on which facet you're looking at. Now, the cause is the same, but obviously the pain could be coming from something different. So you could have a stress fracture in the spine. Another potential issue you could also have with that, if that's not checked in time, it can become a complete break, and that's what's called a spondylolisthesis. And again, you definitely wouldn't want to be running with that kind of injury. Another injury is called a spinal stenosis, and that's when you get a narrowing of the foramen or the spinal canal, or the area in which the spinal nerve roots come out from the spine. That's basically the most common thing is a build-up of bone in the hole. It makes the hole smaller and again can irritate the nerve. Now what you might find is if you have a spinal stenosis when you run, you tend to run leaning forwards because that opens up the foramen and creates more space for the nerves, and therefore can take some of the pressure off of the nerves. Now another condition, again I see this quite a lot, is called sacroiliac joint dysfunction. So with sacroiliac joint dysfunction, if I just show you Rodney again here, so this is the sacroiliac joint. Now whenever you're on one leg, which is all the time when you're running, the sacroiliac joint has to be stable because it has to transfer forces up through the leg and into the upper body. Now remember, it could be up to 4 times body weight per stride. Now that has to be maintained nice and stable. Now if that joint is unstable, you're going to be creating excessive friction across the joint, which again can cause irritation, it can wear down the cartilage, and it can cause a lot of pain. So what I'm going to do in a future video, I'm going to explain to you what you can do to help with those conditions, what stretches you can do, what exercises you can do. But I do recommend, if you have any of those conditions, please do go and see the appropriate professional to help you, someone that knows how to condition the body. And I would suggest you use someone that has a holistic approach. So in order to see those future videos, make sure you subscribe to the Body Check YouTube channel, make sure you like the Body Check Facebook page, and I look forward to seeing you on a future video. Bye for now.